Assalamualaikum warahmatullahi wabarakatuh. Alhamdulillahi rabbil alamin wassalatu wassalamu ala asyrafil anbiya'i wal mursalin wa ala alihi wa sahbihi ajma'in. Assalamualaikum warahmatullahi wabarakatuh. My name is Dr. ASPALILAH ALIAS from Faculty of Dentistry, University of Science Islam Malaysia. Today, I would like to talk about my research topic entitled Forensic Age Estimation in Children using Coronoid Process of Mandible from Dental Panoramic Tomography, a Geometric Morphometric Study. This is my contents of my presentation. As we know, forensic anthropology is defined as the field of study which focuses on examination of human bone systematically in order to get identification of remains in medico-legal case. As we know, we have 206 bones and each of the bones have a special characteristic. In case of mass disaster as tsunami, where the remains were massive, the process of identification became complex and difficult. Recent research focused on various skeletal elements to quantify variation related to sex, age, and race to facilitate forensic identification. The mandible is the strongest bone on the skull and is important for forensic age due to their significant morphology changes in during growth. The mandible coronoid, the green one, is one of the part of the mandible that involves in mastication, attachment muscle, and bone remodeling. The coronoid process change actively during growth. Geometric morphometric analysis is a powerful analysis measure not only size but also visualization of variation of the bone. It started with the landmark application that preserve the geometric biological structure. And dental panoramic radiograph is a 2D radiograph that capture the entire mouth including teeth, the upper jaw, temporomandibular joint and nasal area, and usually used by the dentist. DPT has advantage of the low dose radiation and cheaper than the 3D radiograph. So our objective is to determine the coronal age variation in children by using geometric morphometry on dental panoramic image. What we do is we take 305 dental panoramic radiograph and we divide into two groups, which is 3 patients with 3 to 7 years and also 8 to 12 years. And then all the edentulous damage mandible and foreigner we exclude, and we include the adult intake mandible and Malay. And then we do a geometric morphometric analysis and we come with the shape of the mandible. So first we do a landmark using a TPS DIG, and then we do the analysis using the Morphology. At the end of the result, we can visualize the shape variation of the age of 3 to 7 years old and 8 to 12 years old. So what happened? First is 6 landmark. This is a coronal process. 6 landmark of the coronal process. This coronal process, and this is a notch of mandibular, and this is a mandibular ramus for both sides. We put 3 at the right side and the 3 at the left side. So we did a general purpose analysis to remove translation, rotation, and scaling. And we found that the blue dot represent the mean, while the black dot represent the landmark position for individual configuration in the sample. So from that, we found that there are 8 shapes of the variation of the coronal process of mandible in Malaysia. And the first PC is the highest one, 37%, and followed by PC2, 20%, and PC3, 12%. So this is the red is group 1 and the blue is group 2. So we do the discriminant function analysis. We found that the coronal process of mandible can differentiate within 74% and 63% after cross validation. So in the Procassus ANOVA, we can see that there is significantly difference between size and shape of the cornea process of mandible in Malay. And this is we see the significant difference. We found that the light blue is longer or than the dark blue. So this is a group for the group 2 elderly children. Then this is we can see the changes of the cornea process. So this study show that cornea process of mandible can be used for age estimation in the children, and the geometric morphometric analysis revealed that there are 8 variations of shape on cornea process of mandible that show in principal component analysis. And the Procassus ANOVA and discriminant function analysis also show that significant differences between age group in children. And wireframe also show obvious shape changes, especially at the area of the tips of the cornea process. And the visualization of the wireframe show that tip of the cornea process in the group 2 higher than group 1. And the correct process of the mandible is the attachment of muscle of mastication, which is masseter and temporis, and both muscles are involved in elevation and retraction of the lower jaw, are important for biting. Then this variation in the shape and the size of the correct process are useful in anthropological study, for race detection, and forensic investigation. So in conclusion, geometric morphometric analysis is an option tool for estimating the age of the children mandible. The focus on correct process of mandible is given another option than the T. As you know, T cannot age, but we can see also at the correct process the age of the patient. So in the future, I hope that the integration of using artificial intelligence needs to be used in thousands of data set for more accurate result in age estimation. So this is one of the cases that we use on 3D data, mandible unknown cases of the mandible. We run the CT scan, and then from the database, we know the sex, ancestry, and also age of the patient. So the patient is 47, around 47 years old, Indian, and also male. So we won many competitions, awards, and we share starting from 2018, 2017, we share the knowledge because I'm one of the pioneer bringing this knowledge to Malaysia. So we went to the Spain to learn, and then there we go. We built up a book to sharing to the society. So this is my references, and I would like to thank my student Siti Aisyah Ammar, then my friend Nojihan, Dr. Arofi, then the friends from Indonesia, Pandey, Niwa, Dr. Niwa, and also my student, Dr. Mama Faiz, that helps me along the way. Thank you very much. I hope I end with the man arada dunya fa'alaihi bil ilmi wa man arada akhirah fa'alaihi bil ilmi wa man arada huma fa'alaihi bil ilmi. Barang siapa yang menghendaki kehidupan dunia maka baginya memiliki ilmu, dan barang siapa yang menghendaki kehidupan akhirat maka wajiblah baginya memiliki ilmu, dan barang siapa menghendaki keduanya maka wajiblah baginya memiliki ilmu. So thank you very much. Assalamualaikum warahmatullahi wabarakatuh.